What do you think is the most common symptom you see men not only come in with, but one that they maybe minimize or don't really understand the importance of?
For me, one of the most important symptoms would be a reduction in the frequency of morning erections. And generally anything on the sexual side of things, people can be reluctant to talk about.
And do you think that's a deliberate omission of that, or do you think that they just maybe don't think that morning wood is that big of a deal, or something they just thought was maybe related to age, or not related to testosterone at all?
So the morning erections could be something that's just misunderstood.
Yeah.
The low libido or erectile dysfunction, I think more from a psychological standpoint, it's viewed by some people as what it means to be a man, and people can be reluctant to admit that there's a problem in that area because they may feel for whatever reason that makes them lesser of a man, which of course is nonsense. It's a problem that if you're having an appointment with a healthcare professional, there's problems and there's fixes, and we've got to know the problems in order to be able to fix them. But I think there's still just a stigma around wanting to speak openly about private things. The Britishness within us of what we don't talk about that. And I think that's the reason why.
Do you think it's improving though?
Yeah, I think so. I think people are getting... I think that's the key of being a good clinician, of trying to make someone comfortable enough to talk about these things. And it's something I had to do a lot when I was working in mental health services, because sexual problems can be very common with antidepressant medications. So I think it's just about how you phrase it. You just have to say, I'm going to ask some really personal questions.
And also, as a clinician, there's just nothing that is going to shock you. Or, a patient's not going to come in and say, oh, I'm not getting erections in the morning anymore.
Yeah.
Your reaction is not going to be one of shock or what?
Absolutely
it's
not.
just, these things are, you just have to get past it and make the appointment. And
we speak about things of this nature all day, every day.
But from their side though, they don't, you know, so it's hard to process that.
Yeah, of course, I totally understand. I had to have an ultrasound done on my testicles when I was younger because I'd found a lump. It was the most embarrassing thing I've ever had to do in my life. The nurses that were administering it didn't care. That was one of 15 patients that was coming in to see them that day. They weren't fazed at all, but I was terrified. So yeah, I understand it. I can get it. It's a very personal thing, and it can be hard for people to open up about that.
And do you think it always has to be the male or the man that does this? Did you ever get partners, girlfriends, wives being the person who kind of comes first or instigates that?
Yeah, we'll often do joint appointments.
Really?
Yeah, it's a really good idea actually, because you can often get the insights of the partner because they're observing things about the man that he might not necessarily recognize himself. So I actually love doing joint appointments because it means that as a couple, they've maybe recognized a problem and want to do something about it, which is fantastic, because then there's support for the man. It's not something that he's trying to hide from his partner, or doesn't have to feel, oh, I don't want to admit that I need hormone replacement. And yeah, it can be really good to do joint appointments.